our patient population, because it's more elderly and rural, and sometimes they put off care that they need, it's extremely important that we're here because otherwise they just wouldn't go get treatment because they would have to go sometimes up to an hour just to get routine preventative care.
We would be forced to drive to Chambersburg, which where we live is going over 2 mountains, and it's how many miles?
45 miles.
45 miles.
So it'd be a good hour drive, say, to get there.
Each way. If it would close, there would be a lot of sick people running around. They just could not afford to drive that far. We have no public transportation to speak of. We rely on these places close.
For patients, if they have to seek specialty care, if they had to go even to Harrisburg, hour and 15 minutes away, they would have to drive that far. For older folks, they don't want to drive over the mountains, especially in bad weather. They have to ask their son or their daughter to take a day off of work to drive them. And as a result, they oftentimes don't seek the care that they need.
Ray has cardiac amyloidosis, which was diagnosed here in this little community hospital. We just got some answers quick, and I think saved his life.
We wake up at 2 a.m, my child's sick. I know there's an emergency room within 5 minutes of my house. Whereas if it was not here, we would be traveling 45 minutes to the local hospital just to get care. From elderly to children, they take care of it all here. So we need this.
When you hear some of the stories of the patients that actually come here and what would happen if this place weren't here, it would be a very different result for this community.
People's lives are prolonged, people's lives are better because of places like Fulton County, Tyrone Medical Center, Nascent Medical Center, all these small hospitals throughout Pennsylvania, because we're located in communities, again, that are over an hour away from specialty care and tertiary care. And if we didn't exist, and if we do not continue to exist, our patients, our community, will not get the care that they need to treat disease, and just as important, to prevent disease.